Hello, I'm Ji-Eun Lee from MSK MRI. Let's look at two different cases. Which one would you suspect to involve a PCL tear? While the decision might seem straightforward, with many possibly leaning towards the left case as indicative of a tear, let's delve deeper. Why might the right case not be considered a tear despite displaying longitudinally increased signal intensity within the PCL? This case is mucoid degeneration of the PCL. Mucoid degeneration of the PCL should be diagnosed when the ligament remains intact and thickened, coupled with increased signal intensity on fluid-sensitive sequences. This diagnosis is particularly relevant in patients lacking a history of trauma or knee injury and who show no clinical signs of ligamentous instability. The PCL's intrasubstance mucoid degeneration may also present a striated, tram-track appearance, with thickening that could be mistaken for a tear. This confusion between mucoid degeneration and a PCL injury is common, but several distinguishing features exist. For instance, the normal course of fibers and the presence of low signal intensity margins can aid in differentiation. Specifically, in the case of intrasubstance mucoid degeneration of the PCL resulting in a tram-track appearance, the abnormal signal should not disrupt the ligament's margins. In this case, despite the visibility of high signal intensity within the PCL, the presence of intact low signal intensity margins clearly visualizes a striated, tram-track appearance, indicative of mucoid degeneration. Additionally, it's worth noting that the ACL, like the PCL, can undergo mucoid degeneration. However, the presentation slightly differs. For the ACL, an enlargement with increased signal intensity and low signal intensity fibers running parallel to the ACL's long axis is observable. This is known as the celery stalk sign. The ACL may also show lateral side wall erosion and reactive edema. Unlike the PCL, which presents a tram-track appearance, the ACL exhibits the celery stalk sign.